We're going to move ahead and talk more about the airlines throughout the next hour, but also throughout the day here at Yahoo Finance. But something else we want to talk about is what is going on with COVID-19 and how we get people back into normal routines. Joining us now is Dr. Shira Doron, Epidemiologist and Associate Professor from Tufts University's School of Medicine. We appreciate your being here.
Good to be here.
So how do you undertake reopening in a situation like this?
Well, it's been challenging. People are excited to reopen, but they are nervous about the reopening. We have a lot of people here at Tufts Medical Center who have been working throughout the pandemic and throughout the surge and are sort of used to it by now. But we have other people that have been at home and aren't used to taking care of COVID patients, or patients who might have suspected COVID, or patients who have no symptoms, but we now know might have COVID. And so there's been a lot of education, there's been a lot of physical plant modifications, and a lot of new logistics to handle.
And Dr. Doron, when you look at the reopenings that we have seen and the uptake in cases and hospitalizations that we have seen, it seems as though some places and some individuals are sort of willing to take that calculated risk and seem to think, or maybe haven't thought it through, that the medical system can handle it at this point. That maybe we haven't flattened the curve entirely, but we flattened enough that the medical system has adjusted. What do you think of that idea?
Well, to some extent, we have adjusted. To some extent, we are more prepared for another surge than we were for the first surge. Although here in Massachusetts, we handled it quite well. And then to some extent, there's no amount of preparation that can withstand a certain degree of surge. So we've acquired more ventilators. We know where patients are to go during a surge. We've trialed and succeeded at, for example, putting adults in the pediatric intensive care unit, where before we didn't know how that would work. So those are ways in which we're more prepared. But to some extent, there are only so many beds. There are only going to be so many ventilators. There's only so much space. And at a given point, a surge will overwhelm a health system.
Hi, Dr. It's Julia LaRoche. I want to go back to the point that you just made around education, because it seems like consistently we're seeing folks who just aren't wearing masks, or they're large gatherings, or you'll see with bars with people out and about. And I'm wondering if you've seen or heard anecdotally from your colleagues when it comes to patients, are they just getting wrong information? Why is it that folks are so resistant to wearing masks, those sorts of things? Just wondering on the education front, what you're seeing.
Yeah, I think there's a lot more room for education of the public. Here at Tufts Medical Center, we almost never have patients that come in from outside that refuse to wear masks. But, I have heard of that in other hospitals in other parts of the country. That is more of an issue. I think that we definitely have our work cut out for us to make sure that the public understands what we're trying to do here. And one point that I think has been missed is when we reopen the economy, when we reopen businesses and retail and restaurants and bars, we're not just rolling back the clock and acting like we did in February. If we do, we'll see the same consequences that we saw in April in terms of an overwhelmed healthcare system. We have to do it differently in using the new normal. And I think what's really missing is, why did we do it in the first place? It wasn't so that you don't get sick. It wasn't so that I don't get sick. A lot of people have to get sick from this virus. A lot of people will get sick. Remember, it was to flatten the curve, not eliminate the curve. It was so that everyone doesn't get sick all at the same time.
So let me interrupt you on that, because you mentioned another wave possibly, and yet we have Dr. Fauci saying we're still in the first wave. That troubles a lot of us when we hear that.
Right. So many states have not seen their surge yet. And so they're still on the uptick. They're still going into the surge. When I talk about second wave, I'm really talking specifically about Massachusetts. We went up steeply. We had our surge. We are coming down now, and we are now here in Massachusetts in preparation for the second wave, which will truly be a second wave. But that is an important distinction to make.
All right. Dr. Shira Doron, epidemiologist and associate professor, Tufts University School of Medicine. Thank you for joining us on The Move.